Facebook. Thank you for joining me, your host Rehanna Ramsay, on Your Health Matters. We have today in studio with us two doctors, Dr. Monique Williams and Dr. Tamika Lonchan, medical officers attached to the Women's Health Department of the Ministry of Health. And they're here to talk to us more about some of the issues related to women's health and the functions of the department. Welcome, Dr. Williams and Dr. Lonchan. Could you just tell our listeners and viewers about yourself, a little bit more about yourself before we go into our discussion? You can start, Dr. Williams.
Good afternoon. Good afternoon, Guyana. Thank you for having us this afternoon. I'm a medical doctor by profession. I'm also a wife and a mother of two. And, it's just great to be here.
Hi, good afternoon, everyone. Thank you for having us today so that we can spread some awareness on some of the most important functions. I am Dr. Lonchan. I am also a medical doctor by profession. I currently work in the Women's Health Department of the Ministry of Health. I am also a wife, so I really do. And most importantly, I'm a woman. So, I think this is a great area where we can really raise some awareness and get some feedback and sensitization out there to the public.
Mm-hmm. Yes. A lot of people don't know this, but the Women's Health Department is actually something that is under the Ministry of Health. Is a department that is not well known. Mm-hmm. Could you tell us a bit more when we speak about women's? That's a broad topic, women's health. What are we looking at exactly?
All right, so first thing, health, as we know, is a complete physical, mental, and social well-being of an individual. It's not only the absence of a disease or infirmity. So women's health basically encompasses all of that, but we pay a special interest in women. Now, as we know, the anatomy of the man and the woman is different. So with that now, we diagnose and we treat differently. We pay special and keen interest to issues that involve women all the way from their menstrual cycle, knowing your menstrual cycle, understanding your menstrual cycle, all the way up to your fertile years where you would, now consider if you want to get pregnant, if you want to have babies, for the persons who don't want to have babies, for the persons who are infertile, who are trying to get pregnant. And then, we take you all the way up onto your menopause stage and your post-menopause stage. So it's everything with a special interest and a special focus on the woman.
In terms of our anatomy, you spoke about how we differ from men. Mm. In terms of that, what are some of the issues that women should look out for? I mean, we have issues with cancers, infertility, and that sort of thing. But what are some of the main things that we should pay attention to as women?
Okay, so to say that there's something that we should pay a main focus on, or something that is more important than the other. We at the Women's Health Department, we believe that everything concerning the woman is important. Everything concerning the woman is necessary and it is vital. We pay attention to your sexual and your reproductive health cycles, whether you're infertile, we pay this. We tend to listen to, because sometimes we as women, we just need someone to listen, right? So we have those services available as well. We have contraceptive services that are available, prevention of sexually transmitted infections. All of these are services that we at the Women's Health Department provide, and also form collaborations with other departments of the Ministry of Health to provide this service to women.
And by that you mean the hospitals, the health centers, and so on?
Yes.
Mm-hmm. You touched on menstrual cycle. Mm-hmm. What are some of the common issues associated with women who menstruate and so on? Could you shed some light on that? Give us a little bit more into some of the problems that women would have, some of the complaints they would have.
So, the thing with that question is that it's very important, yes, because what we have found is that a lot of the women are not very educated. They may feel that they are, but some of the information is what they would have gotten from grandparents or from very long heritage, and it's not necessarily the medical sorts of things. We have women who sometimes have very irregular periods and they think that that is quite normal. They don't seek help until it's time to conceive, and then they're having difficulties conceiving, and that's something that they should have been aware, and that's where the Women's Health Division comes in with special focus. We're out here, we're more administrative, and we do a lot of sensitization and raising awareness so that you, as a person who would have heard this message, would be able to tell, oh, well, this is not right. So we look at women who may have like menstrual disorders, like you're talking about, women who have irregular periods, women who bleed very heavily, women who may have conditions such as raising awareness about PCOS, which is a polycystic ovarian syndrome. We look at women, well, raise awareness in terms of endometriosis. And, well, in the coming years, we want to do a lot more of in terms of infertility and in terms of endometriosis with women who have had multiple miscarriages and those kind of things. Right now, as Dr. Williams would have said, we're basically raising a lot of awareness in terms of your promoting safe sexual and reproductive health. Like that part in terms of making availability or knowing where you can get proper access to contraceptives, choosing the best contraceptive for you, because it's not one cap that fits every person. It's making an informed decision, and not just informed, educated decision as to what you're given, why you're giving it, what are the pros, what are the cons, and what are the things that you should be able to look out for.
Or anything that, oh, I can use this contraceptive. So
exactly,
it's important that they know what fits them as an individual based on their,
as a couple.
Yeah, and based on their circumstance, their unique circumstance.
Exactly.
You mentioned infertility, and this seems to be a growing issue in Guyana. A lot of young couples, young women have issues conceiving now. Could you expound on what are some of the recommendations for them at this point from the perspective of the Women's Health Department?
So I really love this question. The reason I love it is because you notice you would have directed the question at that a lot of women have found that they have issues with infertility. Well, while that may be true, I'm here to also bring the information that infertility is not gender specific.
Yes.
It is also a male. In Guyana, we grew up with the tradition and the trend. Oh, they don't have kids. Was she barren and that kind of thing? And a lot of times they've found that it's not always the woman. Actually, there are times when the male may have a problem. So infertility, we're out here to raise awareness. It's not necessarily a female problem. It is a problem that both of the sexes can have. And we basically want to raise awareness and sensitivity to the persons. Like, we don't want when it's such a taboo topic that the women are ashamed because they've been victimized when they don't have kids by a certain time. And you don't know what emotional and psychological trauma you're putting this woman unnecessarily through, especially if it may not even be her fault. So there are a lot of conditions where a woman can be prone to infertility, but there are conditions where a male. So the most important thing is recognizing that after you have been trying for a certain amount of time and doing all the correct things, that there are fertility clinics, and we do there are services that are available, I know, at the Georgetown Hospital, where you can go and they will do the necessary checks, and so to help you figure out if it's necessarily the woman or if it's the male, and help you towards your step in becoming a parent, even if that is something that we have available in the public sector. If it requires like in vitro and such, that's not something that's currently available in the public sector. Yeah, that's something that's more privately oriented. So depending on the cause of the infertility will depend on the treatment that you would have. I know a lot of persons will talk about the PCOS, polycystic ovarian syndrome, and that's a whole topic for a whole day on its own.
Yeah,
but I know that's one of the most common topics, and that is also one of the most common forms of or causes of infertility in the young women that we see today in Guyana.
And if I may add to what Dr. Luncheon just said, it's important as women and even as men, because Dr. Luncheon did mention that infertility is not only in women but in men also. It's important for us to make safe and healthy sexual practices, because one of the causes of infertility could be as a result of a prolonged sexually transmitted infection, because sexually transmitted infections are usually asymptomatic. You don't know you have them, all right? And you don't know you have them until it's at a stage where you're trying to get pregnant and you can't get pregnant. And when you do go and you do your investigations, you would realize it was as a result of a sexually transmitted infection. So at the Women's Health, we also promote safe and healthy sexual practices as well, for both men and women.
As we are on that topic, I understand that the Women's Health Department is a part of implementing the sexual and reproductive health policy that was brought on stream a couple of years ago. Could you give us an update on what's happening with that, Dr. Luncheon?
So we are mostly working with the different stakeholders to get awareness out there and to get a lot of support, because in terms of the sexual and reproductive health policy, everybody may think that we're only talking about contraceptives, but we're not just talking about contraceptive. We're talking about everyone having access to contraceptives, having women decide when it is they want to get pregnant, and not just when, if they want to get pregnant. It's a lot about promoting safe sexual practices and encounters, and that they're healthy. And most of it is just right now in terms of getting stakeholders buy-in and promoting it from the different areas, because this is not just a Ministry of Health. While Ministry of Health may be the main focus of it, we still need the buy-in and the help from other areas, because that's how we'll get the information out there, whether it's the different departments or the other ministries that may be useful to us to help getting. And we also have to remember that healthcare services in Guyana is not just public. There are some persons who prefer to have a private healthcare provider, and we have to make sure that the the sexual and reproductive health policy, we're looking towards a standardized level.
Universal.
Exactly, and it's what you're offered in the public is what you're offered in the private, and what you're offered in town is the same thing as what you're offered in the hinterland. We believe in equitable access for healthcare services for all women, all throughout from region 1 to region 10 of Guyana. So that's where we are with that.
And for those who don't know, you said sexual and reproductive health. Could you break that down for persons who don't know what you're talking about exactly? Because most people think about they think about the contraceptive, and they think about just hearing about using condoms and having stuff to protect themselves from sexually transmitted diseases. Could you expound, just tell our listeners what we dealing with when we talk about sexual and reproductive health and the policy that guides it?
So we're talking about family planning. When we speak about family planning, people will colloquially know it as contraceptive. We're talking not just about family planning encompasses even more than just a contraceptive. It's deciding when is the right time for you and your partner to become pregnant, if that is the decision that you have both made, and that is the way that you want to go along in your life. It is talking about having healthy and safe practices, choosing the best practices that are healthy, that you are free from sexually transmitted infections, and that what is the most important thing is that the information that is provided to you is credible, that it is evidence-based, and we're not saying that my foreparent told me this or my great-grandmother said that this is the best way to do it, so that's how we can do it, and I'm going to get a boy child if I sleep with somebody, or we have we have relationships on a certain day of the month. Those are the things that we are here to dispel. Okay. So sexual and reproductive, important things about sexual and reproductive health is having good and informed and educated decisions about what it stands for. It means safe sexual practices, being able to access a sort of family planning that may be useful to you. It's not just about that, it's also about women and taking them through pregnancies, during antenatal, during the pregnancy, which is the perinatal period, as well as post-pregnancy. And that's one of the things, what's the typical thing in Guyana? Once a woman got pregnant, she gets her vaccines and she go home. You don't ever hear back from her until she gets pregnant again. And that's what we're moving away from. We are actually promoting women wellness clinics and having women be able to go in to have like just chats with the doctors where they can be told, this is the time that you should be having a pap smear done, or a VIA, whichever one is applicable to the person. When it's also to do a self breast examination, or have a doctor do an examination. Those are the things that are all encompassed under your sexual and reproductive health. So it's health for the woman, basically, from the time she's young, giving her the right educational material so that she can make the best decisions from the time she's a teenager or even younger, to when she becomes a woman in her fertile period, as well as when she becomes a grandmother or a menopause or a postmenopausal woman.
In terms of your work in the department, I know that you are centralized right now in Georgetown. Basically on the coastline. Could you tell us how far your reach is in terms of?
So the ministry, even though we are centrally located in Region 4, the ministry, one of the biggest mandates of not just the Women's Health, but the Ministry of Health, is equitable healthcare services. Meaning by equitable is that it's not equal, it's equitable. Meaning that whatever deficiencies you may have in the other regions, that you are given the necessary so that you can receive the same kind of care along with the coastline. So when we do go out and do a lot of clinics and providing like contraceptive services, and so we actually do that more in the hinterlands than in the coastline. The coastline already have services that are being provided by the different areas, because we know that they have a lot more facilities, and so we do make sure that we go out into the hinterland, doing outreaches, providing family mobile clinics where they have access to contraceptives and choosing the best one for them, as well as even some STD screening and treatment and education. So our scope, we go to the different regions, Region 7, Region 9, a lot of the hinterland, even Region 1. We do a lot of the hinterland. And when we go out into those regions, that's usually when our department would do the most clinical practice. And on the coastlands, we do more of sensitization and training for the coastlands. So we also do trainings for the hinterland so that when we leave, these persons still will have access, because it's not just whenever somebody from the ministry goes in, then they can have access. So we want to make sure that we're equipping the persons that we leave to get the care that they deserve.
In terms of awareness of what is of your sexual reproductive health issues and so on, could you shed light on what is happening in the hinterland? Are these persons are they taking keen interest in what you're telling them? Have you found, I don't know if you can touch on that a bit.
So in the hinterland region, it's very important and it's very necessary for us to provide them with the information that they need so that they can make these informed decisions, because what we find in the hinterland regions is that access is a problem, right? Access to information, access to services is a problem. So to say that they're keen on it, we provide the information. And when we return to do our visits, from our reports that we would get, we would find some sort of progress, for want of a better term, but it is something that has to be done over a period of time, because access is very limited. And that's why we try to focus our attention on the hinterland areas, because of accessibility.
Okay, so we'll just take a short break now, and when we come back, we'll be talking more with the medical officer You're joining me, Rehanna Ramsay, and we have in studio two doctors from the Ministry of Health, Women's Health Department. We were talking a lot about some of the issues that we would have as women, in terms of some of the awareness you spread and all of that. But we have a few questions coming in from online on Facebook. We'll go to that in a few. But before we look at that, I'd really like to hear how this whole pandemic has been affecting the work that you do at the department.
All right, so as worldwide and internationally known, COVID has put a damper on a lot of our services, but nevertheless, we continue to persevere. We would have still been able to provide mobile family planning clinics, especially to our hinterland regions. We just ensured that when we went in, it was safe. We practiced all the necessary COVID-19 protocol guidelines, more so in terms of socially distancing ourselves and stuff like that. We also, when we left the regions, we would have ensured that they had enough of a supply of contraceptives, to last them, because we won't know when or how soon we'll be back in, because we got to take into consideration, or what we took into consideration going into the regions, we would have looked at their cases, like how many cases they would have had. So if we noticed that a region would have a lot more cases, we would try to, not go to that region, because in all, we have to use wisdom and we have to practice all the necessary guidelines. But it would have affected us a little bit, but we were able to persevere nevertheless. We were not, completely shut down, for want of a better term.
Just a little addition to what Dr. Williams has said. Yes, she did speak about the hinterland regions, but that's not to say or to discredit that the other areas or the other regions did not or they stopped their family planning and their clinics that they were offering. These places would have still been offering. You may have had a bit more spaced out visits where persons would have been, instead of being provided with 1 month of treatment or contraceptives or so, like the ones who are on orals, they may have been sent instead with 3 months, so that you have a little longer period. Obviously they would have been advised that adverse effects or any adverse reactions to any of the medications or so that they would have been given, that they would seek services before. But we would also not discredit that in the other areas that they also continue to do their work and they continue to serve. We know that the healthcare providers have really stepped up during this pandemic, and we have continued for frontliners, and we will continue to do so for as long as the pandemic, or even if another one comes about.
I promised to go to a few questions from Facebook. We have a viewer who's asking about the Women's Health Clinic, asking about Women's Health Clinic or unit in Berbice. Could you speak to that? What facility you have in Berbice to provide for?
So the Women's Health Department, as we would have mentioned, is a central unit. We fall under the Central Ministry of Health. So we're not located in Berbice, but our services will range, as we would have mentioned, throughout the different regions of Guyana. So there's no specific women's health division or department in Berbice, but when the different regions do need our help with training or with service providing, because we would also do a lot of training in terms of contraceptives, giving them how to give them, and so we would also do training in terms of complications that may present during the pregnancy or so. So they would advise us, different regionals, because that's how we work. We work by a very multi-sectorial or multi-regional rather approach. So they will advise us based on their needs, and we would make the necessary arrangements to go there and to provide our services. But as a clinic or a specific department, no, they would have their normal services provided by their OBGYNs, which will be available for the persons who access public health care at their specific hospitals, health centers, even the midwives, not just specifically the doctors and midwives, and also the nurses are also, they also participate in a lot of the trainings.
And if I may add to, and I'm sure probably what the individual may be asking is if there's a specific women's health clinic at a particular facility in Berbice. And while Dr. Luncheon mentioned that, we're centralized, I'm sure the option of, having a women's clinic in Berbice would not be something that is open, that is not on the table for our women's health coordinator, who's Dr. Umade Ratan. I'm sure she's going to be open to, if, that's a path that we would want to take. We can have discussions and probably start a women's health clinic there, because we women, we tend to have our niche, where we can come and be in an environment where we're comfortable, that we can talk, we can discuss, and so I'm sure our coordinator would be open to having something like that too.
Okay, doctor. So there's another question. Somebody mentioned women not being comfortable having male doctors look at them in terms of dealing with female issues. How do you recommend the health ministry or the unit goes forward with that? I think that's a tough question, but it's a very good question, because a lot of women prefer to deal with their own gender when it comes to issues.
Yeah, it is a tough question, because as healthcare providers, we all would have taken an oath to provide the best care independent. We do not discriminate against sexes, ages, even infirmities or illness. We do know that there are persons or women who would prefer to have a female doctor. One of the most important things to remember is that accessing healthcare is your right. And if you are uncomfortable with your male practitioner and there is someone else who may be able to provide you with the service, you can request that service. You can actually ask and say, I would be more comfortable with a female practitioner, a female doctor. It's not to say that we are advocating that you go into your health facilities and demand, and that everybody demands, because the male doctors are also, we need to give his jacket, and the male doctors, a lot of them, what we find, tend to be more sensitive to the women and their issues. I mean, you have some bad apples in every crate. So that's not to say that everybody will show you that, but that's also one of the things that we try to touch on when we do have trainings, to make sure that you are sensitive to a woman who is coming bearing her all at her most vulnerable point, that there is sensitivity. And sometimes as women, because we are women and we feel that we may react to something a certain way, we don't sensitize, or we're not sensitive to the issues that another woman may be going through. We do know that some of the religions would actually prefer for a female practitioner to see the patient, and we do understand that. And we'll stand by what we said. It is your choice to ask for care from a different provider, but we would also ask that you also sometimes give the male practitioner a chance. Once it does not make you feel uncomfortable, because you have to feel comfortable, and it is the doctor's job to make sure that you feel comfortable. You might go in feeling a little overwhelmed, and you don't feel like you want to tell them your personal details. But one of the good things, the most remarkable things about a good doctor is that feeling that he or she gives you from the time that you walk in, building that rapport between you and them, making you feel at ease to tell them anything. Sometimes people just want to come there, and you put them at so much ease, they forget they have a problem. They don't even want to leave with treatment. They'll say, Doc, I feel so much better just speaking to you. So we should never underplay the emotional aspect of the care that a healthcare provider will give.
Talking about that, another viewer, the questions are rolling in. Another viewer mentioned the issues that some women experience. I don't know if this falls under your purview. Some women pregnancy or postnatal and prenatal, the depression and so on. How do you recommend doctors or health workers deal with that? Do we have, because I've never really heard of it.
You see, that's a very good question, because let's say, for example, postpartum depression. Postpartum depression now is something that is very serious, it's very real, and it's experienced by a lot of women. All right, so that's one of the areas that we at the Women's Health Department, we focus on your psychosocial health, which entails your mental health, and postpartum depression will come under your mental health. So persons who are experiencing, or persons who would have experienced this condition, or any mental condition, any situation where you need to talk, where you need to find someone to talk to, we have our mental health unit, and we do a lot of collaborations with our mental health unit, and there are services there, there are personnel there that are willing to talk to persons, be open and listen. So persons, we would want to encourage persons who are experiencing that, you don't have to go through it alone. They have personnel that are available to listen to you, that are listening, and sometimes you just need a shoulder to cry, and we have those personnel that are available. It's a collaboration that we do with the mental health unit.
And one of the activities, in addition to that we would also like to start rolling out on, is actually the introduction in the different clinics of the postnatal depression scale. It's the Edinburgh scale, and it's a very short questionnaire, and it will help the healthcare providers identify very quickly. It's a very short questionnaire, and it'll help us to identify the persons who may be suffering from postpartum depression, or who may be at risk for suffering, and we would know that this person requires a slightly different type of care when it comes, and we would be able to involve the necessary areas, whether it's a psychologist or a counselor, and those kind of things, to give them also a little bit more of the psychosocial support.
So you talked about a lot of things about how we can deal with psychosocial support and so on. But in terms of the actual, we mentioned earlier, sexual reproductive health and STIs. Some of the common ones that we would deal with here, how do we treat them, and what are some of those? Can you touch on that, please?
Okay, so the most common sexually transmitted infection among women here in Guyana is the human papillomavirus, or HPV. Now, HPV is so popular among women because there are about approximately 150 different strains of HPV. And it is said during a woman's sexual life, she would have been encountered or come into contact with at least one or two of those strains of the human papillomavirus. It's important to know that 6 and 11 are the ones that causes genital warts in women, and the 16 and 18 are the ones that causes cervical cancer. It's important to know as well that HPV is a completely vaccine presentable disease. The Maternal Child Health Department of the Ministry of Health would have rolled out vaccination for our young boys and girls for the HPV infection, and we would have rolled it out. I think it's from 9 to 16, both boys and girls, and we did from 9 because we want to capture those children that are not yet sexually active. They would be covered from this infection. There's also gonorrhea, chlamydia, and genital herpes that are pretty common over here. And gonorrhea and chlamydia are infections that are most of the times asymptomatic. And when you do present with symptoms, you would have been already far along with the infection. And these two conditions also causes infertility in women. They also prone you or expose you to a higher risk of contracting HIV. All right, so, and genital herpes, it's another big one here in Guyana. Genital herpes, it doesn't have any cure. So it's basically treated asymptomatically, and it does not stay, the treatment, once you're positive with herpes, you can be on treatment and you can still transmit. So they're very serious conditions, and I think that more emphasis and more focus needs to be placed on them, especially on the part of the woman. As I would tell people, you are the only individual that is responsible for you. You're the only person that can speak for you. So it's paramount and necessary that you use protection, that you engage in safe and healthy practices, have monogamous relationships. If you're not want to be monogamous, protect yourself, use a condom, be wise. So those are just some of the most common ones here in Ghana. And of course, other than the gonorrhea causing the infertility in women, you also have HPV that causes the cervical cancer as well. So it's important to know. and it's important to be.
You associate using a condom with protection from HIV, but using a condom could also protect against
Using a condom also protects you from sexually transmitted infections.
different types of
Types of sexually transmitted infections, and is also one of our main major contraceptive method as well. So the condom is the only one that can protect you from having an unwanted pregnancy or pregnancy on the whole and sexually transmitted infections.
We spoke earlier too about about contraceptives, and you talked about not taking it lightly and just going and buy a contraceptive just because you want to keep yourself from getting conceiving. Could you tell us a bit more, break that down so that people could understand in what scenario, what is better for a person based on their specific situation?
So I'll do you one better, and I won't tell you which one to get, because that is a decision that comes between you and your healthcare provider. And I don't want to say they heard a doctor on the radio say this is best for them. So we do have different forms of contraceptives available in Ghana. I'll touch on the ones that are available in our public system. So we have hormonal and non-hormonal contraceptives. Under our hormonals, we have the implants, which can generally last you 3 to 5 years. We have oral contraceptive pills available, as well as the injections. Some women will know it as the 3-month injections. Under the non-hormonals, we have the IUD, the intrauterine device. Most persons will know it as the copper T. And as Doc would have touched a little bit just now on condoms, which we know have the dual function of prevention of pregnancy, as well as the prevention of transmission of STDs or sexually transmitted diseases. And those are all like temporary forms of contraceptives that I would have mentioned. And they are some women and men or couples who would have had or reached their desired amount of children, and they would start looking towards some more permanent form, saying that they would no longer desire having more children. And those are the things that when we talk about tubal ligation, or what the woman goes through as known as the tubal ligation, right? And it's a bilateral, both sides, for both ovaries and the tubes. We kind of basically make a disconnect so that you can't become pregnant. I'm trying to keep it simple.
Sever it.
Several, I don't know.
Cut it.
So yes, to cut it. And then what's important to remember that a lot of persons will say, oh, the woman should just go and get this permanent tubal ligation. But we do know, and we are against that men can have what is called a vasectomy. It is the male equivalent of a woman tying her tubes, and it is also a form of contraceptive. The same way that a woman may have her tubes tied, a man can have a vasectomy done that will help to prevent pregnancies in their relationship. What is important to note is that we use what is called the medical eligibility criteria, or a wheel, that helps us to identify the different stages or the different parameters a woman may be going through based on maybe her age, or if she's postpartum, different criterias. And it will tell you the different forms of contraceptives that may be applicable to the person, whether they have chronic illnesses or so. And it will say that these are the options, and these are the options that are best suited for this person or this couple. And based on that, you sit down with your healthcare provider, and it's not just them saying that you should use the oral contraceptive pills. It's them telling you the pros, the cons, and helping you as a couple. Or even, we don't live in a time where a man has to sign off on the contraceptive for a woman anymore. And it's you making an informed decision about which one you will choose, right? So that's what we focus on, using the medical eligibility criteria to choose or to help the patients decide which is the best form of contraceptive
and
for
that
them.
would be what you're basically saying is that they see a healthcare provider.
They should
before.
see a healthcare provider. It's not go to the pharmacy and buy, or they decide there, because there are many things that you may not know that may prevent you from choosing an option, whether oral contraceptive pills are good for a certain type of person. Maybe they're not very consistent. That's not a good choice for them. If they're not going to remember to take it, the pill is no longer very effective, right? So it's the best way is to have your initial meeting with your healthcare provider, have them and you sit down and have a nice long conversation, and you can even go home and come back and decide which one it is you would like to try.
Also, I want to add there, it's very common in our society, in our country here, where our young ladies feel that it's okay to run to the pharmacy and get a morning after pill. Now, the morning after pill is basically used for emergency contraception. All right, mostly in our settings here, rape victims or victims of violence and stuff like that. We want to ask our listening women to please desist from, you had sex last evening, then you check your cycle. Oh shucks, I was ovulating. Let me go and get a morning after pill. We're kind of asking you to desist from that practice and just go to your healthcare provider. You don't want to get pregnant right now. Go to your healthcare provider and sit and have the conversation so that you can make that informed decision of which one of the contraceptive methods would be appropriate or best suiting for you.
The morning after pill, I know that's a common one. What are some of the dangers associated with using that to
the abuse of it.
To abuse, yeah.
Yeah, the abuse of it. Persons would complain of a lot of bleeding and a lot of spotting and stuff like that. You can have damage to your uterus as well. When you're trying to get pregnant, you can't get pregnant because of the abuse of this pill, because that particular pill is used for emergencies, not for every 3-day use. All right, so we need to be aware, because you're causing more damage to yourself. And then when you're trying to get pregnant, you're trying to figure out, how is it, why is it I'm not getting pregnant, but you can't remember your previous practices. So we need to be aware, we need to be conscious, we need to make informed decisions.
So we'll go to a short break, and when we come back, we have just a few more questions on women's health issues. Kaieteur Radio. I'm your host, Rehanna Ramsay, and I have with me two medical doctors attached to the Women's Health Department of the Ministry of Health, and they're talking to us about women's health issues. We would have covered a wide scope of women's health matters. We talked about pregnancy, prenatal and postnatal care. We touched a bit on infertility. We touched a bit on STI, so it's a broad topic, and we didn't focus specifically on one thing. We tried to cover as much as possible as it relates to women's health issues. And as we're wrapping up, we will have Dr. Luncheon talk to us some more. Dr. Tamika Luncheon, she's talking to us here today on Kaieteur Radio, and she will talk to us some more about the other services of the Women's Health Department besides the health issues that they cover. She will tell us about some work they do with gender-based violence. Go ahead, Dr. Luncheon.
So Also under our purview in the Women's Health Department is we are the focal unit that deals with gender-based violence. How it is that we would work on this? We basically are responsible for the referral pathway of the gender-based violence victims, determined in terms of the health aspects. When I say this, I mean I'm talking about when the victims would have arrived at a health facility, saying that they were assaulted or so. We are the persons who would be responsible in terms of how the healthcare provider provides service for them. What are the necessary coming? We are responsible for the protocol in how they would assist this person in terms of when they provide them with the emergency contraceptives, protection from possible exposures to STDs or unwanted pregnancies. And, we are the persons who would do a lot of training in terms of how to do the rape kits and those kind of things. We focus a lot more on the medical aspect, and we are the referral pathway. And trying to also, what we're advocating is for victims not have to go to multiple facilities to get the different services that would be needed. We want that these victims who are already traumatized, that they have access to all the things that they need to have at one facilities, because we know when we have to send them here, there, they're already traumatized, they're emotionally upset. They will, when you say leave this hospital and go over to that health center and get this service, and then when you're done, go back over to here, we tend to lose these persons. So that is why we are responsible for all the medical services that would be provided for this person to be provided at one location, to avoid that emotional unrest that we will be putting that person through.
Yeah, so that means basically that, if they go to Georgetown Hospital, they must have a unit there set up to deal with the...
It might not necessarily be a specific unit or a specific area, because, you might not have, it wouldn't necessarily say that you'll have 100 patients every day. It depends on the circumstances and so, but they will have a designated person that should be covering every shift in the case that a person does present with as a gender-based violence patient. Doing the police reports, making sure that we are correctly documenting all the different injuries that the person may have, or even lack of injury, because we also know that a lack of an injury does not mean that the person was not assaulted.
The Women's Health Department, attached to the Ministry of Health, they deal with a lot of issues. But in terms of your yearly calendar, could you give us some details as to your plans this year?
All right, for this year, the Women's Health Department will be focusing on a lot of sensitization. So it's not only sensitization for the public, but we're also going to be sensitizing our healthcare workers. We're going to be providing them with a lot of training in the different areas that we, provide services, or contraception, and training in the rape kit services. And, as we progress along with the gender-based violence, we would also like to provide some training in that area as well. We also will be continuing our mobile family planning clinic, where we go to the different regions, more so the outlying regions, and provide family planning services, contraceptive services to our women. We are also going to be having a campaign on menstrual hygiene and period tracking, because while it's sad to say, a lot of us, we don't really understand our menstrual cycle, and we really don't, understand what to expect, why we're having these symptoms. And I myself, I can speak for myself. Sometimes, I'm so happy now, and by the time the ending of the day, I'm in such a foul mood. And then when, I check myself, oops, my period is coming. So, these are information that we would want to provide, especially more so to our adolescent girls. And so that's basically it, more so to provide sensitization. We're also going to be following up with the gender-based violence and forming support group, which is going to be a collaboration with the Human and Social Services Ministry, to provide these services to our women. And like Dr. Luncheon said, we need to get to a place where, or women or victims of these conditions can go to one place and have that service being offered to them, but not without being bounced around and having to relive the situation every time.
Just in addition to one of our other activities, one of the other things that the Women's Health, or one of the other mandates of the Women's Health, is the maternal mortality surveillance.
Yes.
It's a very important part, and this is, when we say maternal mortality, we're talking about maternal deaths, and we are a unit that is very important in this type of surveillance. Our unit is the one that provides the care, and we do a lot of the training. And so in terms of in the ministry's effort to help to decrease maternal mortality, I mean, one of the indicators that determine a country's how good the healthcare service is in a country is the maternal mortality. And we are responsible, or we have a very keen focus on maternal mortality surveillance and reduction, and a lot of our trainings are geared towards, and when I say healthcare workers, I'm not speaking just of doctors, I'm speaking about all the different categories of healthcare workers in identifying situations that are emergent and deserve critical attention and on-the-spot treatment. And what's most important is identifying those situations, and that's one of the things that we do training for. And we also do training in terms of the antenatal training for the different healthcare workers in antenatal services, identifying potential diseases that may result in severe complications or even the death of a mother.
And that means you would be in contact with people in Berbice, in Essequibo,
Yes.
the various healthcare providers.
Yes, so the training is throughout the country. We do training in all the different regions, and these services are available at your regular antenatal health centers, and those are the persons that we generally target because those are the ones who see the mothers at every clinic. So it's at all the different locations.
In terms of collaboration, I understand that the department collaborates with a number of agencies. Just shed some light.
So the healthcare delivery for a woman is multi-sectorial. We do depend a lot on services from other agencies, whether they're NGOs such as UNICEF, or we depend a lot on PAHO. We do have some collaborations among occasionally with the GRPA, the Ghana Responsible Parenthood Association. But it's what our objective is, and our collaborations with all these agencies is towards providing a standardized care, right? So we want that the care that is provided in every single area is the same, not that you get one sort of care in this area, but these are agencies that would help because they also would see patients. So standardized care, and it takes a village.
Yeah.
So we do need support. The ministry can't do everything on its own, because some of these agencies will even help a bit with financial, or they would help, with training and stuff like that.
So we have actually come to the end of our program. But before we go, we just like you to tell our viewers where they can learn more about your work and in terms of women's health issues. How can they get in contact with the department or anything like that? So just tell them quickly.
All right. So the Women's Health Department, we're on Facebook. It's Women's Health Guyana. They can contact us via there. They can also contact us through the Ministry of Health's Facebook page. And they can get us on 223-5310. Just ask for any one of us, or coordinator, Dr. Rattan, myself, Dr. Williams.